The slides from today's webinar will also be available. I'll send those out to all of the participants from today. And the same thing as with the recording, if you feel like a colleague would benefit from the information, feel free to share it. For anyone that I have not met before, my name is Richelle Andrae. I am the Government Relations Specialist at the Wisconsin Primary Healthcare Association, which is the primary care association for the 19 community health centers here in Wisconsin, located across the state. WIPCA's role is to provide training and technical assistance to those 19 community health centers. So we're thrilled to have many of you on the line today. If you can help me out by just adding your name, role, and health center to the chat, that would help us just track attendance for this meeting. So again, that would be your name, role, and health center would be so helpful. You've landed at our Schoolhouse Rock webinar about the state policymaking process. I am a child of the 90s, so everything I know about truth in the world comes from Schoolhouse Rock, and there is a classic cartoon of Schoolhouse Rock from when a bill becomes a law. I think I must have seen that many times as a child. It did inspire me to go back and watch the video, so if you're not familiar with it, we're going to go through a bunch of those pieces today. If you have any technology issues or questions throughout the call, please feel free to add those into the chat. The chat is also great for questions, and I'm going to ask my colleague Carly to go ahead and monitor that for us. And also feel free to raise your hand or jump in with a question or comment as we go. This is plenty of time for your questions and discussion to understand how a bill becomes a law and what else matters in the state policymaking process relevant to community health centers. So I'm going to go ahead and dive in. My favorite quote about policymaking: if you like laws and sausages, you should never watch either one being made. We're going to get a little bit into the sausage making today. So our agenda, I will go through a typical state policy process, both for a bill and for the budget, which is basically a mega bill that happens every 2 years. Talk a little bit about how to influence the legislative process through describing recent examples, actual items that community health centers and WIPCA have been working on, and then save plenty of time for questions or discussion if you have them. I have 3 objectives identified here: understand the process better, how to influence the process, and make sure that you walk away with a few resources. Are there any questions or technical issues for me before I get started today? Okay, then I especially want to thank, I know we have a few health center board members with us, which is especially exciting to me as we continue to work toward leveraging your advocacy and your championship of community health centers. Thank you for spending your time with us today. All right, so at some of this may be a 101, but even as someone who works in this field every single day, sometimes I get a little confused of who's on first and what happens next. So we'll start with the basics. So civics, high school civics class, 3 branches of government: legislative, executive, and judicial. In Wisconsin, our legislative branches are the Assembly and the Senate. In some other states, they may call the Assembly the House, or the lower branch. Those are all the same. We have 2 of those legislative branches here in the state. The role of that legislative branch is to write legislation, pass legislation, policy issues, funding issues. Legislators sit on committees. Those committees hold hearings. Those committees vote on bills and share information publicly about key issues. As I noted, the budget is a significant policy issue. Legislators have a role in that budget process, which we'll discuss a little bit more today. And then most importantly, legislators represent their constituents in state government. Legislators care especially about what the people who live in their district and in their community care about. They also essentially, through their role, represent the good of the state, but their primary interest is their own constituents that they represent in the state legislature. The executive branch is the governor and the state agencies. The big role of the governor is to sign bills into law or to veto bills. He can do those in the entirety or partially, depending on the type of bill it is and what's in there. The executive or the governor also starts the biennial budget making process by essentially providing a proposal to the legislature. A significant role of the executive, Governor Evers now, is to raise issues. We often talk about the bully pulpit. The executive has a big microphone and can use that to talk about the things that they care about and the things that they want lawmakers to care about as well. The executive also makes appointments to agencies. So, for example, the State Department of Health Services, or DHS, has a secretary. That secretary is appointed by the governor. So the governor gets to make selections about secretaries. Now, the legislature sometimes will not approve those agency leaders, but it's the governor's job to nominate those appointments. And then essentially all of the state agencies, the Department of Health Services or any of the other ones, and there's about 30. So the Department of Workforce Development, Children and Families, all of those are essentially run by individuals who have been appointed by the governor and then staffed in state agencies. And then finally, judicial, which has been drawing, I think, more attention in Wisconsin than usual because we're in some unique situations about judicial power dynamics. The judicial branch are the judges. In Wisconsin, we have the Wisconsin State Supreme Court. The Supreme Court arbitrates and issues rulings, and their role is to enforce the laws that are passed by the legislature and signed by the governor. That's the overview. Before I get too far into what actually happens in the policymaking process, I just want to highlight why even care. Why do we do this or try to work with policymakers on behalf of community health centers? Number one, we all know the value of relationships. I like to think that relationships move at the speed of trust. So building those relationships with state and federal policymakers, you never know how helpful it's going to be until you need it. So I think of that as proactive relationship maintenance a lot of the time. Working with policymakers is also essential because they are, in many ways, masters of none. They have to vote and consider hundreds of different types of issues, everything from rate setting for gas utilities to whether or not to authorize a new oral health professional or change the tax code. Or I saw something about funeral parlor regulations last week. They have to think of all of these different issues that their constituents care about. We want to be a resource to them. So when they think about healthcare issues and policy decisions or funding decisions related to their constituents' health, we want them to think of community health centers and help them understand what things look like on the ground. You're their eyes and ears. And then finally, more of the direct side of things is to influence funding and policy decisions at the state level. That could be in the short term, but all of this is a long-term effort at the end of the day. Protecting existing resources is a component of that engagement. For example, most health centers in Wisconsin receive an annual allocation from the state through the Community Health Center State Grant. That's about $6.5 million total, which is split up among 17 of the 19 community health centers. And we need to protect those funds. So even if we're not asking for a change, keeping those funds in the budget is essential. And lawmakers are unlikely to provide funding for entities they don't know or understand. So that's an example of protecting a resource. Often we're also looking to expand resources for community health centers too. More money for something, changing the way money works for something, or transforming the way the state interacts with healthcare. And then finally, aside from funding and resources, there are many policy issues that come before the legislature or that we want to come before the legislature at any given year. So we may want to advocate for policy changes that will help health centers do the work you do already even better, maybe get rid of administrative hurdles, change the way scope of practice looks or the way that funding flows, those kinds of policy issues. So here are maps of Wisconsin's current state legislative districts. As you may have heard, there will be new state legislative maps. I'm going to do a whole separate webinar, hopefully within the next 2 months, about the new legislative maps that Wisconsin will be operating under for the fall elections this year. But these are our current legislative maps. As you can see, there are 33 state Senate districts and 99 state assembly districts. So I'll show you an example because each state Senate district has 3 state assembly districts in it, which is really clear if we take a look at Senate District 12, for example. This is a district represented by Senator Mary Felskowski. She is a big champion on oral health access issues. She represents Senate District 12 in northeastern Wisconsin. Within Senate District 12 are 3 assembly districts 34, 35, and 36, and those are each represented by someone in the assembly. So no matter where you live in the state, let's say you live like right up here in the corner by the UP, you would have your state senator, Mary Felskowski, and then you would also have a state assembly representative. And that's what we call the people in the assembly. We call them our state representatives. So together, there are 128 total people representing constituents in the state legislature. And again, for anyone who has just joined the call, if you would share your name, role, and health center in the chat, that would be very helpful. I will run through a lot of information here, but feel free to raise a hand, interrupt, or drop a question into the chat as we go. So how does the actual legislative process work here in Wisconsin? And before I get into that, I'll note that every state legislature is different. So this is how it works in Wisconsin. This is not the same in Minnesota or California. Their timelines are different, their processes are different. So this is just relevant for Wisconsin in particular. So we run on a 2-year biennial legislative calendar. It begins in January of each odd year. So that was January 2023 is the last time it started. The state budget process begins in spring of that same year, generally in February, which is when the governor will provide a proposal about what he wants to see in the budget. And then the legislature does a whole bunch of work. They will take action on a lot of bills, hold hearings, and then generally conclude their work in March of the following year, which has been getting a little bit earlier and earlier over time. So that's now-ish. And in fact, the legislature, the assembly, that lower house, actually just concluded their work on Thursday last week. So the assembly is not going to be taking up any further bills, taking votes on legislation, anything like that again, until January of next year, January 2025. The Senate is still doing a few more things, but they're going to wrap up in mid-March. That means that campaign season and elections will be the focus of state lawmakers from March all the way through the summer, through the fall, and into those November elections this year. And then in January again next year, the whole thing will restart again January 2025 when new lawmakers are sworn in and start working on bills again. So this is a little opportunity for engagement. To get into the state lawmaking process and policymaking process, I'm wondering if folks have any thoughts on where ideas for legislation come from. If you could throw something in the chat or take yourself off mute and just shout something out, I would love to hear what comes to mind for you. Where do ideas for policy changes or for bills come from? Any ideas from folks? Okay, no pressure. I've got a few. So often they'll just come directly from a citizen. So someone in their district who said they've got a problem, they want the state to take action on that thing. The lawmaker may decide to run with that issue that was raised by a constituent, someone who lives in their district. Often ideas will also come from state agencies. So for example, I know the Department of Health Services was trying to make some changes so they can develop more regional crisis centers for people experiencing a behavioral health issue recently. So the folks at DHS, the state agency, took their ideas to lawmakers to say, hey, we need to make some changes to our laws so that this works better. There are also many types of think tanks and research entities, whether they are fiscally oriented or working on particular issues, or organizations like the National Governors Association that works on various issues across the whole US. Some of these may be more partisan leaning think tanks, maybe that have a particular way that they look at issues. For example, free market think tank in Wisconsin is the Badger Institute that does a lot of free market work. Or there might be entities that have more of a bias to look at working to address upstream and root causes of issues. So there can be items that come from many, many different origins. And I see some additional comments in the chat. I see someone has noted that they may come from board members or different trends that are coming up in the news. I think that's a great example. So there's a lot of focus on mental and behavioral health access and crises right now, and certainly that is driving a lot of the conversation in the state legislature. Lawmakers may also refer to something that's happening in another state to say, right across the road in Minnesota, they're doing X. Why aren't we doing that here? And so that might stimulate some legislation. Lawmakers may also engage in like a task force on a particular issue. So for example, there is a task force that the governor has pulled together related to strengthening the healthcare workforce in Wisconsin. I'm certainly hopeful that that task force will bear some fruit that we might want to work on at a statewide level for community health centers. There are also many different types of lobby and advocacy groups. For example, there are entities that come together on health insurance related issues in Wisconsin that may all be working collectively toward particular ends. For example, WIPCA participates in a group that's led by NAMI, which is a national mental health action group that has a state chapter. We're going to work with NAMI on looking at some Medicaid issues related to reimbursement and access to equitable mental health services. Can anyone think of something else that I haven't listed here that you didn't add to the chat yet? These are, saw some great ideas come through. So a lawmaker, wherever it's come from, they've got an idea from somewhere about an issue. Then here is what an actual bill looks like. I just wanted to give you an example, and then I'll talk you through the process of what happens with this. So an actual piece of legislation looks like what's on the left here, and it's very complicated legal and statutory language. That can be very, very difficult to understand for a layperson. I'm not an attorney, but I have a background in public policy, and even for me, it can be tricky sometimes to figure out what does this thing actually mean and what's it going to do. So the legislation will look like this, but it will always come with a summary, which is an objective analysis from the attorneys that work for the legislature. There will always be a summary about that bill and describe what it does and how it works. So I often refer to those to really understand the ins and the outs of the legislation, which is very, very helpful. So this is generally what a bill looks like. This in particular is a bill related to dental therapy. I'm going to use that as an example for a few different issues today that we're going to walk through. Dental therapy is a proposal that WIPCA and other healthcare groups have been working on for about 7 years now, and that finally became law just a month or so ago in Wisconsin. It will allow a new dental provider type who has more training than a hygienist, but not as much as a dentist, to practice in under-resourced areas of the state. So that's just the background on dental therapy, which again, as I noted, I will use as an example. So here is the law-making process, kind of step by step. Number one, we said that there's an idea. Some lawmaker gets an idea from somewhere or another. Then they will actually draft a bill, get that idea into statutory language, changing the way laws work or adding funding to something. Those are really the two things that a bill can do. make changes to policy or add or change or subtract funding or how funding works. The lawmaker doesn't have to do that themselves. They will work with, again, the attorneys from that group that I mentioned that works on behalf of the whole legislature. And those attorneys are nonpartisan. Their role is not to pick kind of winners and losers in political fights. They are just there as objective experts on how to write legislation. So a bill will become drafted, like that thing I showed you on the left of the former slide. Next, that lawmaker will, once they have everything drafted, they say, yes, I want to get this thing done. They will take that legislation and they will release a memo to their colleagues in the whole legislature describing what they're up to. So we call that a co-sponsorship memo, because what the lawmaker is doing is describing what they're doing, what the bill does, why they care about it, why other people should care about it, and asking for their support. And I want to make sure that that point in the process is well understood, because often if there's something that we're working on behalf of community health centers, this point in the process can be very important, and I'll describe why in a little bit. That will also receive a number, and I'll talk about a few different numbers today. You don't need to recall all of those, but it does get a little bit confusing because there's different numbers for different bills. But it is assigned what we call an LRB number. Number 4 is that legislation, after the co-sponsorship memo has been circulated, the lawmaker, let's say it's Mary Filskowski, who was working on the dental therapy bill, she sent it to her colleagues in both the Senate and the Assembly and said, I'm working on this bill, it's very important to me, here's why and here's what it would do. She's asking her colleagues, sign on to support the bill. Show me and let's show our colleagues that there's a lot of support for this change. So there'll be some period of time, usually about 2 weeks, between when that co-sponsorship memo is released and when the next step, item number 4, happens, which is when the bill is formally introduced. When that bill is formally introduced, it means that it is officially an actual bill in the legislature. It will receive a bill number. For example, Senate Bill 689 or SB 689. So it'll get that specific bill number. And then it will also be referred to a committee. For example, a health bill will usually be referred to the health committee in either the Senate or the Assembly. Usually, a bill is introduced in both chambers of the legislature at the same time. That tends to be what happens because things need to pass through both chambers to get done. So usually there will be a Senate champion and an Assembly champion. They will both introduce the bill at the same time. They will both ask their colleagues for support. And then those will each receive a bill number. It'll receive a Senate bill number, an Assembly bill number. Those are never the same, so it makes things about numbers a little bit more confusing. Finally, if things are all going well, not finally, next, if things are all going well, number 5 will occur. So a hearing will be held in the Senate committee to which it's been referred and to the Assembly committee to which it's been referred. Again, for a health bill, that's usually the Assembly Committee on Health and the Senate Committee on Health. Hearings will be held. Those hearings are a great opportunity to share engagement and to provide input about the bill. Then there will be votes in both committees. Again, this is kind of if the bill is moving all the way through the legislative process, here's what would happen. So there would be votes to support the bill in the committee, both in the Senate and in the Assembly. And then if that happens, there would be subsequently votes of the whole Senate and the whole Assembly, not just the committees. So that's step number 7. And then the governor will receive the bill from the legislature. The governor will sign the bill. That's when a bill becomes a law. We call that enactment of the bill. And then step number 9, which is often overlooked but is very essential, is the rulemaking process. So even when a bill gets signed by the governor, it's not over yet, folks. There's more that happens, and we'll talk a little bit more about that. But the state agencies usually have a role in fleshing out the next steps in the process because not every single last detail was included in the legislation. So that's the general process. I've starred here a few of the essential opportunities for providing input. As I noted, when that bill is being released for co-sponsorship, if it's something that we are really supportive of, gathering input and educating lawmakers when that co-sponsorship memo is released is very important, because if we can show a lot of support for something even before it starts moving through the process, that can help kind of set it on the right track and make sure that it keeps moving. There's a lot of reasons why stuff can get stuck in the process. So when there's an opportunity to collect support on the front end, that can be really helpful. So for example, there was a bill that WIPCA was working on last year where we got, I think it was up to 30 or so lawmakers to all say, yes, we support this bill. Even before it starts getting hearings, even before people start voting on it, we think this is a great idea. And that was a bipartisan group of lawmakers. So that was really exciting to see that support on the front end of the process. The budget, as I mentioned, is like a mega bill. So it goes through the same process as other bills do, but it's sort of all up to the volume is turned up on this because the state needs to pass a budget every 2 years. And there are actually laws that hold the state accountable to doing that. And it always happens. It can be a little bit of a fight because in Wisconsin, there is a supermajority of lawmakers in the Senate. That means that there's more than 2/3 Republicans in the Senate. There is a majority, but not a supermajority of Republicans in the Assembly. And there's a Democrat in the executive branch. So they fight about stuff a lot. But the budget is something they have to get done every other year. If they don't, it would be a really, really big problem. Essentially what happens is our current budget keeps going a little bit, but that can't happen forever. So they pass a budget every other July for the next 2-year cycle. That budget goes through a little bit of a special process with one committee of 16 people that steers that whole ship of the budget process. And then the governor can sign or veto or make partial vetoes of the budget once it's through that process in July. And that state budget is essential because it funds all the state agencies. If you've ever received funding through a state agency to do anything at all, it's all kind of in that budget. And it'll happen formally starting in February, but as noted here, the state agencies will start on their budgets even before that formal process begins, and they'll actually start doing that this summer for the following February when the governor will introduce his budget. So here's an example of a piece of legislation successfully moving through the state legislative process. As I mentioned, dental therapy is a bill that WIPCA and some lawmakers have been working on with other partners for 7 years. So what happened was this issue was reintroduced in this legislative cycle. It had come up in previous years, and I'll talk a little bit about why this changed this time in particular. But the idea was already circulating. Lawmakers wanted to do it. We wanted to do it to get that legislation passed. The lawmaker, in this case, Senator Mary Felskowski, and then there was a representative in the assembly who was also very involved with this, but she was the primary champion on it. They drafted the bill actually last spring in March 2023. So I saw the bill, I saw the text of it, but we sat on it because we were waiting to kind of get the right confluence of factors in place to introduce that bill. We were waiting for the right timing and the right conversations behind the scenes. And then finally, after sitting on that bill for several months, Senator Felskowski and her colleague released that co-sponsorship memo to their colleagues and asked for their support on the dental therapy bill. I have an example of that linked here if you want to take a look at what that is. Then that legislation was formally introduced in November. It received bill numbers. So as I said, those bill numbers they don't really mean anything, but it's how you can look up the status of a bill, or if you're talking to a lawmaker, you would want to know these bill numbers so they can refer to the exact thing that you're referring to. So that bill received the number Senate Bill 689 or SB 689 and Assembly Bill 668 or AB 668. Like I said, those bills hardly ever match up and it can be confusing. But They're numbered based on how many bills have been introduced that year. So you can tell by this being Senate Bill 689, there had already been more than 600 other pieces of legislation introduced before this was by November of last year. Then there were hearings held in both the Senate and Assembly Health Committees in November and December of 2023. Both committees took votes on that legislation in December and then in January of this year. Then, since it kept moving through those committee processes, it went to the full floor of the Assembly, and the full floor, that's the whole Senate and the whole Assembly, in January of this year. They both voted to support the bill, and then it got to the governor's desk, and he signed it on January 29th. He said, yes, I approve this bill, put his John Hancock on it, and then it was a law. And then now, for that bill in particular, there are a few state agencies that will need to put the meat on the bones of that bill and make sure that it is actually implemented. So for example, in this case, the Department of Safety and Professional Services, which is the state licensing agency, they will need to actually get a licensure system set up in place so that people who are dental therapists can get a license in Wisconsin. There's also going to be a little bit of rulemaking that has to happen. DHS is also going to have to make sure that there's a way for providers to enroll in the Medicaid program and bill Medicaid for services as dental therapists. So there will be a lot of things that state agencies have to do. Then there's usually things that other organizations will do too as a result of legislation. For example, in this case, there is a technical college in central Wisconsin who is building out a dental therapy training program to start in fall of next year, to start training dental therapists here in the state. So that is an example of something moving through the process. And in this case, something started in spring of last year, but then was basically introduced in November and then moved through really, in my assessment, quickly from November to January and got signed. So that happened in a pretty tight process for this bill in particular. So that's an example of where things worked well. I will next talk through an example where things did not move through the whole process. This example, well, I'll go through what could go wrong first and then the example. So here's how things could go wrong. So someone's got an idea, they get a bill drafted, they ask their colleagues for support, it's introduced, and now things can start going haywire. So for example, a bill could be referred to a problematic committee. What I mean by that is maybe a committee that doesn't have interest in that issue or that doesn't intend to hold a hearing on that issue. Those decisions are made by leadership in the Assembly or in the Senate. Maybe it's referred to a committee, but a hearing is never scheduled. It is committee chairs who ultimately have say over what gets put on an agenda for a meeting or what gets left off an agenda for a meeting. So if that committee chair is not motivated to hold a hearing on the bill, they can not do so. And that's totally their prerogative. They'll probably also have conversations with their leadership, their kind of elected peers in the Assembly or in the Senate to decide what to do about something that's contentious. But a committee hearing could not ever be scheduled. Maybe a hearing is scheduled, but there was no vote scheduled. So this happened recently with a bill related to pharmacy benefit managers, which are third parties in between insurers and pharmacies. A hearing was held, but they did not end up holding a vote to get that legislation moving out of the committee. It just got stalled. Or maybe it gets out of committee with a vote, but then it doesn't get scheduled for a vote on the floor calendar. So the full House, the full Assembly, or the full Senate doesn't have a chance to work on that legislation. Also, something could get to the governor and not be signed. This happened last year with a challenging piece of legislation related to nursing scope of practice. Both houses of the legislature ended up finding a compromise on this bill. They got it to the governor and the governor vetoed it for reasons we could discuss in another setting, but basically received input from various organizations that he should veto the bill, which he ended up doing, stopped it in its tracks, didn't move forward. Sometimes things also get funky in the rulemaking process. So for example, maybe the state agency doesn't have the capacity or expertise, or they've prioritized something else other than doing the thing that the legislature says they're supposed to do. And we'll talk a little bit more about that. So here are some of the ways that things can go awry in the process. I'm sure there's many more examples I have not included here, but these are some of the typical ones on that train track. Here's the example I noted to go through of something not working out. So this is a bill that WIPCA and again, some other partners have been working on for several years now, which I'll refer to as the postpartum extension bill. The background on this piece of legislation is that in Wisconsin, pregnant individuals who are enrolled in a special Medicaid program receive 60 days of Medicaid coverage and then fall off that program after 60 days and either have to find another source of insurance, whether that's public or private, or ultimately will become uninsured. Most other states, and I think it's 43 of them at this point, have implemented a full year of Medicaid coverage for pregnant individuals instead of the 60 days. So Wisconsin lawmakers have been working on trying to accomplish that here. So here's what happened on the bill this legislative cycle. In the Senate, it moved all the way through. They had hearings, they voted on it. It went to the whole Senate for a vote and it passed, I think it was 31-1. So 31 of 33 lawmakers said it was a great idea. They said, please do this, state, it's very important. So it got all the way through the Senate. On the Assembly side, it kept moving, it was introduced, but it got referred to the Assembly Health Committee, and the Assembly Health Committee never had a hearing on the bill. So it got stalled. In this case, in particular, I think it's safe to say that the reason that that bill was not scheduled for a hearing is because a member of leadership, the Speaker Robin Vos, who is kind of in charge of the Assembly in many ways, he did not think this bill was a good idea and essentially articulated that to the committee chair. And I'm sure there was some fighting behind the scenes, but the committee chair never held a hearing on the bill. And it needs to get through both of these cycles, both in the Senate and in the Assembly, to eventually get to the governor. So that's where the postpartum bill got held up in the Assembly. Now, this is the general process. Sometimes things skip a step, but that would only happen rarely and usually on some big public issue. So for example, when the governor signed new legislative maps a week ago, those maps actually didn't go through the hearing process. There was not a whole lot of transparent things in place, but there was a big interest in the legislature to advance that bill and to get it in front of the governor in a very timely way, pending some other state Supreme Court things going on. So it skipped a bunch of these steps, but that is very unusual. Let me just pause there real quick. I will keep sharing some additional information, but I want to see if there's any significant questions about these processes that I've gone through so far. So any questions are welcome, or something in the chat that you'd like me to clarify of what I've reviewed so far. Okay, I'm going to keep rolling. The committees are extremely important and often really where I spend a lot of my focus talking about community health centers and talking about the issues that matter to you at the policy level. Committees are essentially members of legislators, and there are just committees for people who are in the Assembly and just committees for people who are in the Senate, and a few ones that have members from both, but that's unusual. Like that budget committee, that's one that has members from both the Senate and the Assembly. So legislators may serve on multiple committees. For example, someone may serve on both the Health Committee and something related to public utilities. And the committees are really where lawmakers can do the majority of their work. It's usually something the lawmaker has a specific interest in. Each committee has both a chair and a vice chair from the majority party, and then they have a ranking member from the minority party. And as I noted, the Republicans are in power in both the Senate and the Assembly. So the chair and vice chair of each of these committees right now has Republicans in those leadership positions. As I noted, the chairs are the ones who set the agenda. So if a chair does not want something to go through their committee, they can just not put it on the agenda. and it'll just sit there without much attention. Each committee is also comprised of a majority of members from the majority party. So for example, the Assembly Health Committee has 18 members, so 18 Assembly people or representatives sit on that committee. A majority of those 18 members, by the way our committee structure works, are Republicans and comprise that committee. Committees, even if they have a focus, let's say a health issue, they take up a very wide range of topics in that committee structure. So everything from this postpartum bill to a dental therapy bill to newborn and infant screening to vaccination requirements, a very wide range of issues may come before a committee. And I appreciate the note in the chat about kind of power dynamics and influence. And the more I do this work, it does become clear that there are particular individuals in the legislature that hold a lot of sway over colleagues. And I think a lot of people come into the legislature with a lot of ideas and opportunities to work together. And sometimes these processes start putting sticks in the spokes of that bicycle, if you will. There are also, even with all of that challenge though, there's a lot of checks and balances in place and a lot of opportunities for the public to weigh in. So all of the committee hearings are public, all of their agendas are public. Anyone can go into a committee hearing and watch it happen. You can do that in person. If you were in Madison with me and just walking around the state capitol and there's a hearing going on, you are entitled to go in and watch that hearing or even speak at that hearing, no matter who you are. They would probably frown at you if you came from California to come talk on a hearing about a Wisconsin issue, but you could. So I always encourage people to know kind of what's going on in the legislature, who their representatives are, and to engage in these hearings because that is part of your right as a citizen. As I noted, the rulemaking process is essential. And I kind of think of it as the abyss because once it moves to the legislative process, there's a lot more stuff that can happen, but it's a little less transparent. It's a little harder to know what's going on unless you spend your time, like me, focusing on that every day. So once a bill gets signed by the governor, as I noted, state agencies in particular really will flesh out the details of that legislation. So often it'll be the legislation setting a floor on what has to happen, and then the agency will put the details on around additional constraints, but they can't change what's in the legislation. So the legislation says, here's generally the minimum of what has to happen, and then the agency does the rest. So for example, WIPCA worked on a bill that was signed by the governor in 2021. I refer to it as Act 98 because that was the number that when the governor signed, it became the 98th law that year. This allows Medicaid to bill, or rather pharmacists to bill Medicaid for services provided to patients, which they actually couldn't do before that and still can't, but the agency has had a lot of other priorities. This was signed right in the middle of COVID. And the agency has been slow in implementing this legislation, but they're getting it done now, but it took several years. And what the Department of Health Services needs to do is articulate exactly what services will be allowed. Is it everything a pharmacist can do? Is it just a smaller subset of things? What are the conditions on provision of those services? How will those services be reimbursed? I know the state was thinking, for example, of filing collaborative practice agreements, which are agreements between the pharmacist and a physician about the scope of those services. So lots of details that weren't in the legislation itself that are now getting figured out. And the agency, in this case, has processes. They're talking with external partners like us, like health centers and hospitals and free clinics to figure out how to do this. And eventually, this year, they will get all of that figured out, and then pharmacists will be able to start billing for Medicaid services. But it did take a long time, and we really need to exert influence over some of these things in the process. And often, various initiatives will take a long time. So it can take multiple legislative sessions, which again run on a 2-year calendar, to get something done. Or sometimes things happen really, really, really quickly and come out of nowhere. There's a lot of different components that can influence what happens, but time is definitely an ingredient in that stew. So for example, I noted that for that dental therapy bill, we've been working with partners and with lawmakers on this for 7 years. So across almost 4 legislative sessions to get this done. The first time it was introduced, there was very significant opposition from the dental lobby on this bill, a lot of conversation, some pretty big blowouts at committee hearings of people in disagreement about what to do. But over time, we worked with the authors, we worked with the dental lobby, with WDA and with others to make changes to the bill, to give it some time to breathe, to bring in new evidence, to educate lawmakers more, to share more stories about patients who aren't getting oral health care and how this bill could make adjustments to that situation. We talked to different people about it. There were changes in staffing and in the dynamics of how people worked on this bill. And in this one in particular, we ended up packaging the bill with some other oral health issues that other people wanted to see done. So that was all going to move together or not move at all. So we kind of leveraged the interest in those other bills to get this one across the finish line, which, as I mentioned, did ultimately lead to the governor signing the bill about a month ago. And with all these things, you might wonder, gosh, how does the legislature get anything done at all? This is so complicated. And I feel that way sometimes too, but I do want to point out that the governor has signed 94 bills as of last week. So those are 94 things that the Republicans and Democrats agreed on in some capacity. Those were 94 issues that will hopefully make Wisconsin safer, healthier, work in ways that people of the state wouldn't want to see happen. So it does all take time and is complex to navigate, but eventually many things do happen in the legislature. So just a few questions to run over here. What happens if a bill doesn't get over the finish line? So I noted that postpartum bill didn't get all the way through the assembly. It will need to start over again next January. So everything kind of runs through this clock through spring, and then anything that doesn't get over the finish line, it just starts over. So it'll need to be reintroduced, new co-sponsorship memos, new hearings, new everything. That will start again in January. So next year in January, there will be a whole bunch of bills that all get introduced right away because a lot of people have pent up stuff that they didn't get done this year to start again next year and give another go at it. In committee, oftentimes people will disagree. If a bill does not have a positive vote out of committee, it's probably going to be dead. That bill is likely not going to move forward, and it probably needs a majority of Republicans in committee the way things stand now in the legislature. If that's not the case, it's very unlikely to move beyond that point to further votes. Bills can also get amended. We see a lot of bills that have a hearing in committee, and then there's some issues that get raised or some need for compromise on the bill to move it forward. That can happen at various points. For example, I mentioned there's some pharmacy benefit manager related bills. Last time there was a bill that was very sweeping to reform pharmacy benefit managers, and then there was also interest in getting something done, but not that whole sweeping thing. So it was amended to be a little bit more narrow. So it didn't make that much changes, but it did nibble around the edges. And then I'm also certainly mindful of our partisan political dynamics in Wisconsin. So as I noted, there's a Democrat in the executive's office. There's majorities in both the Assembly and the Senate. That is certainly a significant thing to keep in mind whenever any organization is trying to get work done. If a bill is introduced by just Democrats, it's probably not even going to get as far as a hearing. On the other hand, the Republicans know that if they want to get something done, the governor's going to have to sign it. So they're going to want to find some support from their colleagues to move something through the process. Bipartisan bills are generally best because it shows that there's support from multiple wings of multiple parties. I do want you to be aware, and we could spend more time on this another day, but there are really good public systems in Wisconsin for tracking legislation. If you know the name of a bill or the number of the bill, which since it's my job, I tend to do this and track them all. If they're relevant to community health centers, we can look up that bill online and the link here to do that. It'll take you to a page like this on the right. So Senate Bill 689 is the dental therapy bill, and it has all of this information about the bill. And you might look at this page and just think it's gobbledygook, which it is until you dig in a little bit further. But here we can see that the bill was introduced by Senator Felskowski in the Senate, and on the Assembly side, it was introduced by Representative Plummer, so they're listed here. And then this list also has everyone else who agreed on the start of the process to co-sponsor the bill. So as I noted, that helps us understand what the support is, where it's coming from. So we can see who introduced the bill, who are the lawmakers that already want to support it on the front end. We can see all these dates. Here's when it was introduced. We can see where it's at in the committee process. So I can see that in December, there was a public hearing held on that bill. And then we would also see that it was voted on in the committee process. You can also click on a lot of different resources here to see what was the testimony from all the organizations who went to that hearing. What do they think about the bill? What do they have to say? So if we were to click on that hearing information, you would see that WIPCA's got information in there about this bill and about why we care about it. So that's all publicly available. Another system that is very useful for folks like me who are trying to figure out what's going on with legislation is our state lobbying website, which is called ION Lobbying. That's also linked here. If we were to go to this link, you would see for any particular bill, what organizations, so organizations like WIPCA or hospitals or other insurance organizations, any type of group that is a registered lobbying entity like WIPCA, we would register on that bill to say we love it, we hate it, or we have some other opinion about it. So that's all publicly available on this website too. Lastly, this link here is from the Legislative Reference Bureau. They are a bunch of attorneys and other super smart people who work on behalf of the legislature and the people of Wisconsin to describe the state policymaking process and what that looks like in practice. Really good resource. WIPCA does also have lots of different resources and collateral. For example, for every person in the state legislature, we create this document here, which is specific to that state legislator. This, for example, would be for Clint Moses. He chairs the Assembly Health Committee. And this is a map of where the community health centers are in his district and how many patients we served, actually that are his constituents served at community health centers in particular. So we develop these kinds of resources for community health centers to use, as well as issue briefs and other information on key topics, like a few of the issues that I just described. So I just ran through a lot of information. I do want to save 5 minutes for questions, and then I also have a poll and can review additional resources with you if you'd like. So let me pause there and see if I can go through any questions that came up in the chat. Feel free to add them in or take yourself off mute. I do see a question that came directly to me about a list of all of the community health centers in the state. I will provide that in a follow-up to you, Alicia. What other questions could I answer for folks today? Okay, as you're thinking of questions.
Yes, I have a question.
Yeah.
This is
yes,
Curtis.
please go
I
ahead.
have one question, right? So how do you see in the future the new district maps affecting policies
Yes.
around health and health access and health equity in the state, particularly as it relates to the work of the health centers?
I love that question, Curtis. Thank you for asking it. So as noted, we'll have new legislative maps for the November elections. And I anticipate that based on the maps that were signed by the governor last week, many of those districts will be more competitive than they have been in the past. So that might mean potentially some changes in the balance of power in the legislature. We're not sure exactly, what that will look like, pending who the candidates are, what the turnout is. But it's possible that Democrats may regain control of the assembly. It would be very difficult to see that happening in the Senate. That also means that they're probably going to need to work together a little bit more than they do now. And I think something that is often understated is that since these districts are likely going to be more competitive than they are right now, the candidates in those districts will need to lean a little bit more toward the middle with the types of policy issues they work on, the types of messaging they have. There may be more interest to move toward less contention than there is currently in terms of the incentives and motivation. So I wouldn't say that there will be overnight a dramatic change in the types of policies that get signed by the governor, but I think there will be more bipartisanship than before. And I do think there will be more center candidates and policymakers than we see currently.
So how do you see the board members of health centers being part of that and helping, to do that, to bring, the left and the right to both more toward the center? Because,
Yeah,
I'm a board member of Milwaukee Health Services, right?
yes.
And I really appreciate the work of Dr. Isler and his passion for equity and, and all that supporting the work of WIPCA and other health centers.
Yeah.
So how do you see board members being a big part of that?
I would say that the role of board members, and this is, up to each individual health center to lean into, if you'd like, is doing education for candidates in your area in a nonpartisan way. So there are, specific requirements for nonprofits about maintaining neutrality in elections. So there's no candidate endorsements, nothing like that, but making sure that there is direct engagement for any candidates that are running in the seats that are represented by your health center areas. So bringing those folks in for a roundtable discussion on the issues you see impacting your patients. Even nonpartisan voter registration efforts. We work with an organization called Vote ER and share that information to community health centers. Making sure that patients know where they can register to vote, where they can vote, what their rights are, again, in a nonpartisan way. Those are some efforts that health centers can take on, and particular for board members to engage in some of those efforts. So encourage the health center to have the League of Women Voters in who does nonpartisan voter registration efforts, or invite
Okay,
those candidates in.
and my last question, and I'm sorry to kind of ask these
No
questions,
problem.
but again, because I am a board member, I am not boxed in just to provide the education. I can step outside of the box and do advocacy. Is that correct, or your thoughts on that?
That is correct, with an asterisk. So as in your role as a board member representing the health center, I would encourage strictly nonpartisan efforts in that particular hat. You also are a private citizen, and if as a private citizen you would like to engage in other efforts, that is totally your prerogative to do. But I think there is a carefulness around doing that in your official role as a board member or as a health center staff person or leadership. And certainly we could have some discussions about that offline too, Curtis.
Yeah, I would love to do that because I'm involved in a number of different activities where
Yeah.
they do advocacy. So I would really would appreciate having that conversation offline. Thank you so much.
Yes, my pleasure. I will stick around for another few minutes. We're right o'clock at time here. I'm going to share a very quick poll. It will take 1 minute of your time. And here we go. You should see that pop up on your screen. It's just got 3 questions asking how we did today. If you could take a minute to complete it, I would certainly appreciate it. I see 4 responses coming in so far. I will give folks another minute or two. And while you're completing the poll, please do, take yourself off mute, bring up a question. I am more than happy to chat through any specific issues or items that came up from today's discussion. And thank you all for joining. All right, I see folks jumping off. Thank you for joining us today. Okay, I see I've got someone from Scenic Bluff still on, but I don't have a name there. Who do I have from Scenic Bluffs on the line?
Hi, Richelle. It's Sam. We have a whole group here.
Hi, team.
2 of our board
Wonderful.
and a bunch of staff. So we just took the survey and we're gonna sign off.
Okay, thank you all so much for joining today. Hope it was useful.
Thanks,
Talk to you
Richelle.
soon. Bye.
Hello.